one, I want to demonstrate how to check blood pressure manually. So first, you'll need to perform hand hygiene and gather your supplies. So you'll need a stethoscope and a manual blood pressure cuff. So let's measure our blood pressure manually. To do that, we want to make sure that the patient is sitting down with their arm at heart level and their legs are uncrossed. Then what we're going to do is we're going to get our stethoscope and our blood pressure cuff. So we want to make sure that we get the right size cuff for our patient's arm. What we're going to do is we're going to palpate the brachial artery because this is we're going to be listening to get our blood pressure. So we're going to be getting our systolic number, which is the top number, and this is the first sound we hear. And then our diastolic number, which is the bottom number. This is the point where we no longer hear the sound. So whenever we're looking at the gauge of our blood pressure cuff, we want to make sure we're really noting those points because it's going to tell us our systolic and diastolic numbers. So what we're going to do is we're going to put our cuff on our patient. And we want to make sure we find the brachial artery. So it is located here. First, what we want to do is to estimate the systolic pressure. So we want to find that number. To do that, we're going to palpate that brachial artery and we're going to inflate the cuff until we no longer feel that brachial artery. We need to make sure that we're looking at this gauge to know that number because that number is our estimated systolic pressure number.
So I'm inflating the cuff by feeling on the artery and I'm going to note the point where I no longer feel the artery, which is 100. Then I'm going to deflate it completely right about 30 to 60 seconds. Then we'll take the blood pressure.
So the estimated systolic number is 100 and now I'm going to inflate the cuff to 130. So I'm going to take my stethoscope, put it in my ears. We can use the diaphragm of our stethoscope. So we're going to place that over the brachial artery.
So we're listening for that systolic number. 100. And let's listen for the last sound. And it was 70. So the blood pressure is 100 over 70.
Then once you have your reading, make sure you fully deflate the cuff full of air and you're going to take off the cuff of your patient. And clean if it's not disposable, and you will document the blood pressure and what arms you took it in. Now, what is a normal blood pressure readings? A normal blood pressure is a systolic less than 120 and diastolic less than 80. Elevated blood pressure would be considered a systolic of 120 to 129 and a diastolic less than 80. Hypertension stage 1 would be a systolic of 130 to 139 or a diastolic 80 to 89. Hypertension stage 2 would be a systolic greater than 140 and a diastolic greater than 90. Okay, so that is how to check a blood pressure manually. Thank you so much for watching.